We split our stages of labour into 3 stages. And we're going to start with the first stage. We split that into 2 sections, latent phase and active phase. So the phase as a whole starts when your cervix is tightly closed, tilted backwards in the pelvis, and is firm to touch and about 2 centimetres long. The end of the first stage is when your cervix is fully open, nice and thin, and ready for your baby to be delivered. We're going to start off talking about the latent phase, when the cervix is going from being 2 centimetres long, tightly closed, tilted backwards in the pelvis, to coming forwards, becoming nice and soft, and starting to open to about 4 centimetres dilated. During this time, you might expect to see a show, which is a thick, mucousy plug, which may have a little bit of blood in it. That's absolutely normal. You may expect for your waters to break. And if this does happen, what you're going to do is telephone us at the unit and tell us how much there is, what time it happened, and what colour the fluid that's coming out is. You might also expect to get some period type pains or some contraction type pains in this stage of labour. And the things you can do to help with those pains are exactly what you would do with period type pain. So you can use simple analgesics like paracetamol. You can use aromatherapy, warm bath, and you can also use a TENS machine if you've hired one of those. We do have some available on the birth centre if you want to inquire about using one of those. The best thing to do during this stage is to stay at home for as long as possible. But you might want to consider calling your birth partner to come and support you and help you to mobilise around, getting to nice comfortable positions, upright positions, leaning forward positions, possibly on your hands and knees, giving you a nice back rub, something nice like that. If you've already chosen to have your baby with Frimley Health Wexham Park Hospital, you'll have been given our telephone numbers for the labour ward, triage and the birth centre. So it might be towards the end of the latent phase that you decide to call us here. We expect that you call us when your contractions are approximately 2 to 3 minutes apart, lasting a full minute and making you really concentrate hard on them, making the frowny face. Ideally for a couple of hours, but whenever you feel you need to phone us for some more support is when you should telephone us. When you telephone us, we will ask you a whole list of questions, starting with some easy ones like your name, going on to things like if your waters might have broken, what colour they are, what amount they are, and what time that might have happened. We'll also ask you things like how many weeks pregnant are you, is it your first baby, have you felt baby move in the last 24 hours, are you happy with baby's movements? Once we've done the telephone triage system, we may well ask you to attend with us. And so if you're invited to come in, what we ask you to do is bring your hospital notes with you and bring your hospital bag in the car. It may be once we've done your labour assessment that we send you back home again for a little while to return later on. When you come in, we'll do an initial antenatal assessment where we'll do your blood pressure. We'll listen into your baby and have a feel. We'll do your test of your urine, and we may do an internal examination if it's a labour assessment you've come for. If you've come for your waters, you think your waters might have broken, we may do a speculum examination, which is kind of like when you have a smear test. It's the same test that we would do. If we confirm your waters have broken, we will make a plan with you, an ongoing plan, as to what we would do for the following 24 hours. If it's found that you're then in active labour, so you've got to the magic 4 centimetres dilated, your cervix is nice and thin, and the baby's head's coming down nicely, we would ask you to stay at the hospital with us, and we can provide you with a few more options for pain relief and hopefully birth your baby with you. So once we've established you're in active labour, we can start to consider further forms of pain relief that we can offer you. And that should lead us to the end of the first stage and the beginning of the second stage when we start to birth your baby.